Okay, thank you, and good afternoon, everybody. I hope everybody had a good weekend and a happy Father's Day. So we have a couple of things that we wanted to share with you today, so we're going to get right into today's data. And then afterwards, we'll look at a little bit at the models that we've been showing people periodically throughout the pandemic. And then we'll take a few questions from the media. So these are our traditional slides that we typically show. Here's the chart showing our hospital admissions. And it continues to show progress. And again, the trend in daily new hospital admissions since early April. Today we report 14 new COVID admissions, bringing our rolling average to 16, and that's a rolling over 7 days. So we continue to see a little bit of fluctuation amongst this number, and we expect to see that. But what's more important is there's still that general downward motion. We seem to have settled at around a 15 day moving average here recently, and so we'll keep an eye on that. Reminder that this data is an average over the past 7 days and has a 2-day time lag. So next we'll take a look at our hospitalization data, and so these numbers showed continued progress as well. So our daily hospital census of COVID positive and our suspected COVID patients, and then the rolling average is of course the blue line. Today's rolling average is 233, which is down by nearly 20 since last Monday when I reported 251. Today's overall hospital census is also down. Today it's at 234. And of course we want to see these trends continue to go downward, and we'd like for them to stay as low as possible. So let's take a look at today's numbers. As I mentioned, we had 234 hospitalizations today of confirmed COVID and suspected COVID patients. We have 50 patients in our intensive care units today, and 32 are on ventilators. And of course now our good news slide. We discharged 11 additional COVID patients yesterday, and that brings our cumulative total to 2,715. And that's 134 discharges since we spoke a week ago. To be clear, these positive trends are due to all of us doing our part in limiting the spread of the virus. And again, thank you to all of our healthcare workers as well for such great work in getting people better so they can go back home. Okay, so that was the data from our hospitalization, our admission data. Now we're going to move to some of our modeling data. And so I've showed this modeling data to you in the past. This is, again, analytics put together by the task force team members, so BJC Healthcare, WashU, SSM Health, Mercy, and St. Luke's. And so, again, this is our inpatient census data. And you can see the blue line was, of course, our best guess data. And this was the one that we've shown throughout the pandemic. The orange line is considered a sort of slow decline in cases, and then the red line represents if we had an increase in cases based on the transmission. And as you can see, our inpatient has been following the blue line most closely. It's sort of in between the blue and the orange line, which we sort of expected as we relax some of our shelter-in-place rules and things like that. But overall, the model is performing very well. And so we're pretty confident that we'll continue to follow this, barring any new outbreaks or anything else coming about. So that was the inpatient admissions. And next one I'll show you is on our ICU census. And this one seems to be following the orange line a little bit more. So that's more of the slow decline rather than our best guess. We're still performing pretty well, though. And so, again, we're pretty confident in our model because this is the one that we've been using really since just a couple of weeks into the pandemic. We haven't adjusted it much at all. And so the numbers are looking pretty good. Of course, we'd like them to be lower. But again, the model seems to be fitting pretty well for our ICU census. So again, just like to recognize all of the progress that our region has made. The St. Louis metropolitan area has really done a fantastic job in keeping our infection rate down and keeping our hospitalizations down, which really translates into saving lives. And that's really due in no small part to all of the work from the entire community, whether that's the elected officials, the healthcare workers, and also just everybody in the community doing their part, whether that's shelter in place or when we begin to reopen the economy, doing all of those small things really does protect the entire community, such as wearing masks, social distancing, washing hands. All of those things add up to protect the community. And we need to continue to do those things again until we either get to vaccine or we get to herd immunity in the population. And so I would just close by saying we need to keep doing those things. The virus is still out in the community. It's still transmitting. There's still circulation amongst the population. But anything that we can do to keep that transmission rate low, we need to be doing. And that's all of those measures that we've been talking about for months now. And so with that, I'm going to end my presentation, and we're going to go to questions from the media.
Our first question is, there have been relatively more cases of COVID-19 in rural Missouri in recent weeks. Mm-hmm. What do you make of this trend, and are you concerned for rural healthcare providers in this state?
So there has been a trend in the rural areas, and when I looked at the data from over the weekends, of course there was this large surge in cases, and it seemed that a majority of the cases were coming from the southwest part of the state. In trying to figure out where those numbers were coming from, it seems that some of that is related to some of the activity going on in northern Arkansas. And so in discussions with some of the other healthcare providers that have facilities down there, of course, I think everybody recognized I think it was a poultry production factory down there had done a large number of testing. And so some of this is a result of that. But also it's because the virus is, in the rural community now. And it's, again, a population that wasn't affected early on. It was more concentrated in the urban areas. And so that spread is increasing out in the rural areas. It is concerning for the rural healthcare providers, but it depends upon that population that's infected as well. And so young, otherwise healthy people who aren't going to put a huge demand on healthcare resources, it's not as concerning to the healthcare system. But if it does affect the older population or people with chronic medical conditions who are going to require an advanced level of care, ICU level care, then that can quickly overwhelm rural facilities. And so that is concerning. So it depends upon who's getting affected by the virus.
Given that new record of new cases reported in one day on back-to-back days for the state of Missouri, does it make more sense now to put stay-at-home orders in place for the St. Louis region? Why or why not?
Well, if you look at the data, the majority of those cases for Missouri were not from the St. Louis City or St. Louis County area. They're actually from the more rural areas, as I mentioned before. And so when you're taking a look at that testing data, you really have to dive into what is causing this surge in cases. And are we going to see a resultant increase in hospitalizations and all of these other things? So it's important to keep an eye on that case count, but it's also just as important to understand what that number represents. And that helps policymakers then make decisions. So I would say if this case number was driven by increased transmission here in the St. Louis metropolitan area, and if we saw, that it was impacting, elderly or people with more chronic conditions, and we felt that this was going to be impacting the healthcare sector, then that's a different policy question than if it's, young, otherwise healthy people. Or was it a result of a large amount of testing being done at some of these facilities? And in that case, that's a different type of policy question. So it just all depends what the data is trying to tell you. There's not a simple one-size-fits-all, increased cases go to this. It's really trying to understand, give context, so that you can really make the best policy decision.
Thank you. That concludes the list of questions received from members of the media prior to today's briefing. Thank you for tuning in.